I'm good to great. This is Yuvaraj from Chennai, Tamil Nadu, India. So I have been studied the Sixki basic course and level 1, Sixki 1 and Sixki 2 with our great professor, a great legend, Dr.D.DuraiSingam sir. I am very much grateful and thankful to our professor for teaching me all the aspects and concepts regarding the Sujok. I don't know what is Sujok prior to learning this course. Actually, even doesn't knowing anything for myself, our professor has taught me with a 200% understanding level, with the combination level of the students. According to the combination level, the explanations with our masters is very great, and the master taught me the easy way of understanding methods by Sujok. The correspondence systems and hand to the body of correspondence systems, head-neck extremities, locating correspondence points, the efficiency of the methods, locating therapeutic with the electric probes, and how to use probe, and how to diagnose by using the probe in 2 hands with all fingers, the massage techniques and the spine alignment of the massages, and abdomens and pelvic and all the regions with matching with the fingers with the whole correspondence methods, and yin yang symmetrical lines and the diaphragm lines and the correspondence systems, locating the difficult points and the small insect points and the many system of correspondence, mark distributions, basic treatment, solar therapy, treatment microneedles, etc. in Sujok basic course. The medicine Sujoki, what I learned is the general principle of the energy circulation, spiral wave, the theory of 60 energies, the manifestation of 60 energy in nature, yin yang meridian of the body, and the connection with hollow and dense organs, the brain and the spinal cord meridians, the idea of energy state of meridians, excess and deficiency energy, quantitative energy disorders, and rules of management applications, tonification sedation, managed therapies of sedation and tonification principles through the meridians and long bone meridians, and application of diagnosis using techniques of fingers for diagnostic, finger Sujoki therapy, algorithm of applying Sujoki therapy using individual bile meridians, the idea of muscles, tendons, meridians, muscle diagnostics, application techniques, practice in muscle diagnostics, and 60 energy philosophy, symptomatic diagnosis of the energies briefly, the law of 5 elements, the function of 5 elements, and the long bile meridians and the topology, clinical examples of analyzing illness using regional symptomatic muscle and application diagnostic, applying different techniques and instrument by using Sixki therapy meridians, acupuncture, max diffusion, seed therapy, color and light therapy, light simulated Sujoki 1, Sujoki 2, Sujoki 3. All the aspects we learn. In about Sujoki 1, Sujok 60 once, I have learned the theory of 6 key principles and the role, the manifestation of 60 in nature, the triaging theory, axial relations, and seesaw principle, internal organs, chakras, single, binary, triple and quadruple axis of 6 key, the concept basic in the additional axis, the chakra system of the body, model of rotating panel, internal chakra and spins, the vertical spin of chakras, circulation of unified energies, the law of 5 elements, the map of the hand, Two types of Sixki energy circulation meridians, structural and functional. A long bile is bile and rules of making prescriptions according to access relations. Clinical cases studies determine unified energy access. The sagittal spin of chakras. Axial chakra treatment level of individual analysis. Internal chakra of the hotness ajna and the internal chakra of the brightness solar, controlling elements which applying chakra treatment of the level of individual energies. And the idea of energy constitution, conditional and acute constitution, constitution of sick healthy person, constitution of mobility. The Sixki elements axis constitution, unified energies, phenomenological energies, functional practical way to define homo heteron groups in 6 elements axis constitution, determining energy and constitution, clinical case to determine the symmetrical constitution of unified energies, and all aspects. The split of a doctor of patients, need to condition of the doctor, and the rules of Sixki therapy, duration of manipulation, depth of inserting needles, time, rhythm, precautions and safety, hygiene. Everything I learned in the 61 course. About 62, the concept branch energies, usually axial points of 60 bile meridians, harmonization, clinical case studies, axial branch energies, bile chakra, bile meridians, cross-linking constitutions, and the 6 energy ways of the energy constitution with the crossing constitution, different individual branch energies, and the multiple constitutions, the concept of structures, position of Sixki, and the internal basic functional diagnosis, internal organ system, wind, heat, hotness, humidity, dryness, cold, Sixki classifications, and indication applying treatment by chakra meridians, local treatment, using seasonal and age-related diagnosis determine the basis of things. Map of the hand, rules of making prescription, treatment through unified individual analysis using subjugation, anti-subjugation, and combined methods. The treatment acute of chronic disease, the idea of energy constitution from the point of view of the law of 5 elements, limitation of 5 elements of approaches of treatment. Other methods using basic energies with color, light, seeds, moisture, etc. Clinical case studies to determine symmetrical and causing constitution on all the level of energy system. Review of the most complicated questions, precaution and hygiene. Apart from all the classes, our professor will send before the class all the inputs like the hard copies and soft copies of the study materials. It will help me to grasp the lessons during the explanation. Nowadays I am practicing individually the Suzuki methods using all the aspects taught by our professor. Very grateful and thankful to my professor Dr.D.DuraiSingam sir and the ISA. Thank you so much.